Okay. Hello, everyone. Good afternoon. My name is Pauline, and I will be the moderator for today's presentation. I wanted to cover a few technical points before we start. You should all remain on mute for the duration of the presentation. We will not be taking questions during the presentation. If you do have questions, you can email them to canhrmail@canhr.org, and we will respond to them as soon as we can. A recording of this presentation and a copy of the slides will be posted on our website shortly after the recording. And now I will turn it over to you, Mike.
Thanks, Pauline. My name is Mike Dark. I'm a staff attorney at California Advocates for Nursing Home Reform. And this will be a short presentation about the rules covering residential care for the elderly, or RCFE facilities, during this COVID-19 crisis. And I'm mostly going to be focusing on issues that affect residents and their families, visitation restrictions especially. Although we are working on putting together a presentation specifically for ombudsmen. Hopefully that'll be upcoming soon. Let's go to the next slide, Pauline. So just a quick note about who we are. California Advocates for Nursing Home Reform was established in 1983. We're a nonprofit, and we really focus on issues confronting people in long-term care in California, including quality of care, access to health care, evictions, and reform of nursing homes and other elder facilities through both the courts and legislation. And you can find our website at CANHR.org. And you'll also see that we have an entire page devoted just to issues relating to COVID. So you should look there if you're looking for more information. So let's move on. So first, what I should say is what we're offering today is really CANHR's interpretation of existing guidelines that we've gotten from especially the Department of Social Services, the state regulator of RCFEs. We're not speaking for any state or federal agency. And sometimes we're even using information that we heard on calls, but that may not be explicitly part of a rule if we think that it will help give you some guidance. So first, this issue about whether or not you're listening to the right webinar. Again, this segment is going to focus just on RCFEs, or assisted living for the elderly, not on skilled nursing or CCRCs or adult residential facilities. But many of the COVID rules, especially for visitation, kind of overlap for the different kinds of facilities, especially at this point in the pandemic. There are some differences, though. RCFEs are overseen by the California Department of Social Services, while nursing homes, skilled nursing facilities, are regulated by the California Department of Health. And most of the material I'm covering today comes from what's called provider information notices, or PINs, that are issued by the Department of Social Services and that you can find on their website, though we also have links, or we're about to have links to those same PINs in the resources section of our COVID page. So look for them there. You don't have to memorize everything I'm saying. You can see a recording, or you can look up these PINs. So let's go on to the next slide. So first, I kind of want to set the table a little before you even get to visitation. Even a month ago, questions about visitation, about staffing, about just about anything regarding RCFEs and skilled nursing facilities could be answered really clearly just by looking at California law and regulation. But we're in kind of a no man's land right now. That all changed because of the state of emergency declarations that were issued by federal and state governments and by some cities and counties. And these declarations give the governments the right to temporarily suspend some existing laws and regulations in an effort to fight the virus. They can't just do it for any reason. It has to be in an effort to fight the virus. And the state of emergency also generally means that some of the normal systems for the Department of Social Services to inspect facilities and work through complaints, a lot of that stuff has really been upended right now. You can find some information on those changes in the provider information notices that we will have up on our site. But practically, it means that facilities and county health services have enormous power right now to call the shots. And that if an individual facility has a policy or a practice that is more strict than the guidelines would seem to permit, it may actually be really hard to fight right now. So long as the policy that they have somehow relates to the spreading of the virus. That doesn't mean you shouldn't document your exchange with the facility if they're doing something unreasonable. It doesn't mean that you shouldn't, in some circumstances, make a complaint, but just understand that we're in a different world right now, and ultimately resolving any problem that you have right now is really going to depend on your relationships with other families who may have residents in the same facility, so that you have some leverage when you're talking. And crucially, your relationship with the facility itself. You may have to use much more honey than vinegar to try to get things done right now, because it's easy for facilities just to say no. So let's go on to the next slide. Oh, actually, let's stay there. So visitation. So the position of California regulators, the Department of Social Services, is that they do not support what's called a blanket ban on visitors, meaning that all visitors can just be restricted. But what they have also made clear when this came up about nearly 2 weeks ago is that when COVID-19 is circulating within the community, it is okay for facilities to ban all visitors. And since in the last 2 weeks, COVID is now so widespread in California, practically, it means that all California facilities can ban all visitors, but there's still some room for exceptions, like for government officials, for doctors who need to visit, other essential personnel. It's also possible that facilities might let immediate family in for what's called compassionate care situations, end-of-life situations. But that's another thing where the facilities will have a lot of room to put rules in place, and you're going to have to negotiate with them. So let's go to the next slide, which is 17. So notwithstanding the fact that facilities can, at this point, put these very strict limitations in place, the DSS has made it clear that they expect that facilities will make accommodations for alternative ways to visit. And what does that mean practically? We're talking about FaceTime, Skype, phone calls, but with the understanding that, for some residents, ones with cognitive impairments, ones with dementia, maybe people who have visual problems, that will be very, very difficult. And in many facilities, it may be that some of these alternative communications will have to be kind of facilitated by the RCFE itself, maybe by having a tablet, Apple tablet or something that they take from one room to another while keeping it clean, right? Because you have to keep these things clean if you're going from room to room. It's also, I think, would be pretty easy for facilities to ease anxiety for residents by arranging something like daily reports or conference calls. And it's not unreasonable to ask for those things, and even to point facilities to the guidance that the Department of Social Services has issued, which you will find on our website, which calls for them to do this. They can't decide just not to do it because they don't feel like it. That is something that they could get in trouble for. If not right now, then as soon as the dust settles on this immediate crisis. Do let us know what's working and what's not working for you. If a facility is not even taking your calls, if you're unable to reach a resident by phone, that's something you can ask us about. You can also ask the facility ombudsperson about that. Tony, that's something that the ombuds people would still be able to help with, right?
Yeah, absolutely.
Yeah. So so let's move on to the next slide, which is 18. I want to also sort of flag that talking about alternative sort of means of communication is not just about keeping your spirits up and morale and showing that you love the person who's in the facility. It's also crucially a kind of oversight, because right now there is almost no other oversight in these places. Why? Because ombudsmen largely are being kept out of the facilities. The Department of Social Services is not doing on-site visits except in very extreme situations. Annual inspections have been postponed. So being able to stay in touch with a loved one in an RCFE, ideally being able to see the conditions in their room, see whether they're well fed, whether the room is filthy, maybe even get a sense for what staffing looks like. Those are all important things that you can do even just with an iPhone or something like that. Let's go to 19. So again, the very frustrating thing right now is, a month, 2 months ago, if a facility was violating a California law about visitation, because visitation is protected by law, this would be very straightforward for us. We would first complain to the facility. If that didn't get any play, we'd file a complaint with the DSS, and the facility would get in a lot of trouble for not permitting appropriate visitation. Times have changed because of the virus and because of the fear that visitors, even careful ones, even people who are being clean, may unwittingly bring the virus in to this population of older and ill people who are very, very susceptible to it. So what you need to do is work with the facilities. You're going to have to get their attention. You're going to have to call them. One of the best ways to do it is, if you're not alone, if you can find other families to work with. There are things called family councils that you can find information about on our website. If there isn't currently a family council, you don't have to have one to try to do this. But what you do want to try to find is other families so that you can together reach out and have sort of the power of numbers behind you when you're asking for accommodations. If worst comes to worst, you can certainly file a complaint with DSS. There's a process for that. We also have a fact sheet about that on our website. But be warned that right now the focus is so much on the spread of the virus, on prevention of infection, that unless the complaint really relates to something that goes to the safety and protection of residents in these facilities, preventing the spread of the virus and the like, you're not likely to get a lot of play, even if you should. And so if there is an element of what you're concerned about that does relate to infection control, or that does relate to, say, staffing or food or access to medicine, access to care, that I think you would get some play. And you want to make sure that you say that when you call the DSS or you file a complaint using the processes that we outline on our website. Let's go on to the next one, 20. So COVID in the building. So here, again, this is kind of uncharted territory. What happens if there is a resident with COVID in the building? There is no requirement yet that governmental regulators inform the public about COVID being in a facility. We're hearing about this much the same way you are, through press reports and sometimes from calls from individual residents or their families. However, I think it's fair to say that it is the view of the DSS and other regulators that facilities should be informing residents and their families about whether or not there are residents with known coronavirus infections, or whether, and I think this is probably unlikely in an RCFE context, but possible, whether they start even letting people in who have the coronavirus. So you should be able to ask your facility administrator, any contacts at the facility, about what procedures they have in place for notification, so that you do get to know if this comes up. We sort of ask these bulleted questions you see in the slide. Who gets that information? Who should be seeking it? Can facilities refuse admissions? In this case, refuse to let people into RCFEs. these are almost sort of academic questions now, frustratingly for us, in that there are no real rules here. And as Tony Chicotel says, this is really sort of a rule of reason scenario. Everyone is expecting one another to behave reasonably. And so if you think your facility is not being reasonable about keeping you informed about its decisions about the virus or about whether people have it in the facility, you should first bring it up with the facility, and then when necessary, bring it up with the regulator, which would be the Department of Social Services. I don't know the answer to whether or not at this point an RCFE could decline to have someone come in who has the virus. I think it probably should, especially if it is naive to the virus, just meaning that there aren't people currently with the virus in the facility. And that's strictly because people there are very susceptible to the virus. And it makes little sense to have people with the infections treated in an RCFE context. So let's go to the next one, which is 21. Coming and going. This is something we're getting a lot of calls about. So the position of the DSS as of March 16th was that residents could leave the facilities for short periods of time as long as they kept social distance, but lots of things have happened since March 16th. It feels like a year. What's been going on since then, of course, you have shelter-in-place orders. You have orders that people not go out unless it's for essential activities. So just, a casual stroll to the local mall or something, that's out. And in fact, it is probably permissible now for a facility to say, okay, you can leave if you want to leave the facility for good because you're not a prisoner here, but we're telling you if you do leave, we might not let you back in. So minimally, if you have, even if you're going to a doctor's appointment, which you should be able to do under the law, there should be no restriction on that. Still, check with the facility, make sure that there's going to be no problem with you getting back in. There shouldn't be for that. For everything else, make sure you know what their procedures are. Are they going to make you, disinfect yourself before you go back in? Are you able to bring in things from the outside, food or other items that you bought? They might say no. And if you don't like it, there might be very little that you can do about it right now. So just make sure you know. To this end, it is very reasonable to expect that facilities provide written descriptions of what their policies are. Yes, they can have restrictive policies, but they can't be secret. You have to be able to know what they are, and your family has to be able to know what they are. So press facilities, RCFEs, to provide you with that kind of information about what their policies are for going in and going out. They have to give you that. Okay, let's go to 22. Oh, so let me also just say, though, before I completely depart from this coming and going, and this is kind of a related issue. Can they make you stay in your room, RCFEs? The answer is, surprisingly, yes, probably they can. And remember, sort of the touchstone right now is, are they doing something that is intended to control infection? And even if it's kind of draconian, even if it's very severe, certainly they wouldn't be letting people eat in the cafeteria anymore. But could they also keep people from wandering in the halls or going and visiting a friend in another room? They probably could right now. You could try to complain about it, but I'm telling you, most likely you're not going to get any play. So make sure you understand what their policies are. If it is not related to infection control and it seems like it's just arbitrary, that's still worth a shot. Maybe an appeal or maybe a complaint. You'd go to the facility first, then you try the DSS. But understand that where they're coming from right now is very, very focused on measures intended to keep people apart, to keep the virus from being transmitted. So now we come to an extremely difficult question, which is, if you are a resident of an RCFE, if you are a family of a resident, should you be thinking about bringing, going home or about bringing a loved one home out of a facility? very difficult to answer this question. It's going to be different for different people. Even Tony and I, we've talked about this a lot because it's very hard to give like a definitive rule of thumb. But even in thinking about it, you need to understand that if the resident has care needs that are pretty considerable, help toileting, help getting out of bed, help feeding, anything like that, that's going to be very challenging to do at home. And there has to be someone who's prepared to do that. It's hard work. The other sort of financial aspect of this is that if you still want to have your room at the facility, you're going to still need to be paying them, and you're not going to get a refund for that time, even though you're at home, most likely. And when the crisis ends, because it will end one day, at least this immediate crisis will be over one day. Where will you go? Do you want to go back to the facility at that point? When you're thinking about your options about whether or not you want to stay or go, make sure you know what the facility is going to say if you do go home for anything more than a few days, because you may not be able to get back in. Okay, Tony, you want to add anything on that particular issue? It's so thorny.
Well, of course, the most important piece here is whether you have the capacity or your family collectively has the capacity to provide adequate care. Right. Anybody who knows me knows that I think a loving family is going to 9 times out of 10 be a better care provider than an institutional setting like a nursing home or assisted living facility. So I think most families, if they've got the time, would be able to provide great care, probably superior care than the facility would provide, just because it's associated with so much love and concern. But the key, of course, is if you can meet those needs, then what happens when this is over? And can you pay for the care during the interim? Because if you don't pay to hold the bed, then you're probably going to lose it at some point. And then there's the issue of the refund. So it's just so much to consider. But I think the number one thing is whatever is safest and best for your particular loved one, do that. There's no way that we can answer whatever's safest and best, but you probably can. And when you know it, then do that. The mic got muted. Oh, no. Pauline, can you unmute Mike?
I think I just did. All right, okay. We're back in business. So really at the end, and we only just have a few minutes, we're trying to keep this tight, is I wanted to spin out a few questions that we've been getting, because we get a lot. I encourage you to continue giving us those questions. That's how we understand what your needs are, and that's how we respond. Just a few quick ones. Can a RCFE require residents to stay in their room? Yes, probably. Is it a good idea? Is it necessary in a community where there's no COVID spread? Maybe not. Could you fight about it? You could try, but you probably won't get anyone's attention right now. They can't keep you prisoner. It's not like you can't go home if you want to go home, but just understand that while you're in the facility, they may put very tight restrictions in place about where you go, who you hang out with, who you eat with, any of that. And most likely no one is going to have any success challenging them right now. Another related question, and we kind of covered this. This is someone who has a mom who's got dementia and is in a memory care facility, and they haven't seen their mom in 2 weeks. And they were important sort of caregivers also, as many visitors are. Not just the facility giving care, people go in, the family goes in and brush their teeth. They make sure that their beds are clean, that they're well fed. And so it is very frightening and frustrating for people not to have that access. And this is temporary, but right now it is within a facility's right to say no. That doesn't mean you shouldn't try every way you can to get information from the facility, maybe even to have a nurse hold up an iPhone or an iPad so you can see your loved ones, to sort of see what their condition is. Go to a window. Tragically, we don't want that. You don't want that. You can also ask families of other residents, especially if there are roommates, if you can get an update on condition. But those are the kinds of lengths that people are having to resort to right now. Let me see if I can just squeeze in one other quick question. Hang on one second. Is there a stay on evictions? What a great question. No. What? How is that even possible? We have all kinds of moratoriums on turning off your power, turning off your gas, on non-payment of rent that mayors are doing, that the governor is talking about. How is it possible that this is not also the case for residents of nursing homes and RCFEs? Tell the governor, man, because right now it is still possible. They are still evicting people. They shouldn't. We have had some success going to facilities just on a humanitarian basis and saying, how do you expect when there is a shelter-in-place order that you're going to evict someone and they're going to find somewhere else to go? That's inhuman. And P.S., even if you think it is human, we'll find some media, a reporter, who might make this very public, and that could be kind of uncomfortable for you. So you have to think creatively. If those kinds of things happen, do let us know. If you have an eviction problem, we can try to help you out and steer you to some good resources. I think that's all I really have time for. Tony, anything you want to add?
Yeah, just one real big point here is the importance of putting communication in writing to the facility. Yeah. We've always preached that, and it's never been more important than to do that now, because I think there's going to be a lot lost in translation related to telephone calls and the normal way you make and in-person discussions that you might have had in the past. I'm thinking a lot of people on this presentation understand what I'm talking about here. It is difficult, really difficult, to get a hold of a nursing or a facility resident at the best of times on a telephone if they don't have their own cell phone. To call a facility and say, I want to speak to resident John Smith, a lot of times it'll take 6, 7, 8 attempts before you actually get John Smith on the phone. We tolerated that in the past. We should tolerate it no more. You should definitely put concerns like that in writing. Hey, it is my communication with my loved one has never been more important than it is right now. And here are the concerns. I am also a caregiver. Here are the things that have worked for me in the past. I want to educate you on that and make sure that you understand what I've done so that you can emulate it and incorporate it. And then please verify with me that that's what you're doing. Written communication is really super important, because I think when this is all over, there will be accountability for the facilities that use this as an excuse, frankly, to provide bad care that they had been providing before. So make sure that you are on top of them in writing and demanding written responses to your concerns.
That's great advice. So 2 really last quick things. Go to our website. You can find summaries of the guidance on visitation for both skilled nursing facilities and RCFEs in written form on our website. We will also be posting a recording of both this video and the earlier video today about nursing home visitation on our website. We're hoping later today. You can check for it. We're going to get through this. Keep tabs on the information that we're sending out. Call us if you have an emergency. Thanks, guys.
Thank you.
Thank you. Have a great day.